Alright, let's take a look at how blood circulates from the heart to the rest of the body. So this is our heart here. We have the superior vena cava coming in here. This brings deoxygenated blood from the upper part of the body into the right atrium. Now, the right atrium is going to contract, and that's going to push the blood down into the right ventricle via the tricuspid valve. Okay, and then when the right ventricle contracts, it's going to pump that blood up to the lungs to get oxygenated. Okay, so we have deoxygenated blood coming in, becomes oxygenated in the lungs, returns to the heart through the pulmonary veins, and enters the left atrium. That blood then goes down into the left ventricle through the mitral valve or the bicuspid valve, and then the left. Ventricle pumps out that oxygenated blood through the aortic valve into the aorta and branches off to the rest of the body. Remember, when we talk about arteries, they carry blood away from the heart. Veins return blood back to the heart, and capillaries are the exchange vessels. So we be looking at all three of these types of blood vessels in this video. Now the first thing we need to do is go up to the head and neck region, and then come back down to the thorax and abdomen and pelvis region. We'll start with the head and neck region. So this is our heart here. We have the ascending aorta that comes out of the left ventricle, and then it branches off into the coronary arteries. The right coronary artery actually travels around the bottom of the heart. So if we were to pull this back, we would see it going around the back side of the heart. The left coronary artery is going to travel along the left side of the heart. So now we go in to take that blood after it's circulated through the coronary arteries and has dropped off its oxygen to the heart muscle. It's going to return that deoxygenated blood back to the heart. And where does it return it? Well, you can see all over the surface of the heart. There are these great cardiac veins. These are going to drain into the coronary sinus, which is a large vein on the back side of the heart. It's going to empty into the right atrium. So we have deoxygenated blood from the coronary sinus emptying into the right atrium. And what else is going to empty into the right atrium? Remember, anything above the heart is going to drain into the superior vena cava. And one thing we need to pay attention to is the diaphragm. The diaphragm is a dome-shaped muscle that sits in between the thoracic cavity and the abdominal cavity. So everything above the diaphragm, including the head, neck, arms, and the upper back, is going to drain into the superior vena cava, which empties into the right atrium. So, in the head and neck region, we have the external carotid arteries that branch off of the aorta. So here's the aorta. We have the brachiocephalic artery that comes off of it, which is going to split into the right common carotid and the right subclavian artery. So this is the right common carotid artery. It's going to go up into the neck, and then we have the left common carotid artery, which comes directly off of the aorta. We also have the internal carotid arteries, which we don't really need to worry too much about for this video. The only thing we really need to know is that the external carotid arteries supply blood to the external portions of the head, whereas the internal carotid arteries supply blood to the internal portions of the head. The external carotid arteries are going to branch into smaller and smaller vessels until they become the smaller exchange vessels called capillaries. The capillaries are going to drop off their oxygen to the tissue cells of the head and neck and then become veins. These veins are going to merge together into larger vessels and eventually lead back to the head and neck region. They're going to empty into the brachiocephalic vein, which is the large vein on the right side and the left side. These veins will empty into the left brachiocephalic vein, which is going to drain into the superior vena cava. Now let's move on to the thorax and abdomen and pelvis region. In the thorax, we have the descending aorta continuing down. Here we can see some of the visceral organs, the stomach, spleen, liver, kidney, and then we have the abdominal organs. So the abdominal organs are going to receive blood from the abdominal aorta via the celiac trunk, the splenic artery, and the renal arteries. Let's follow one of these, like the renal artery. This is going to go down into the kidney. It's going to drop off its oxygen to the kidney tissue cells, become veins, merge together and empty back into the inferior vena cava. So let's continue following the aorta down into the abdomen. Here we have the inferior mesenteric artery. This is going to supply blood to the large intestine. So it's going to go down and give off smaller branches to the small intestine, the large intestine. And then it's going to empty into the portal vein. So in general, any organ that has a portal vein supplying it is going to bring the blood into that organ after it has gone through the intestines. So the portal vein is formed by the union of several other smaller veins. This is going to bring that blood into the liver, The liver is going to clean the blood, and then it's going to send it back out through the hepatic vein and into the inferior vena cava. Moving further down, we have the external iliac artery that comes off of the aorta, and it runs alongside the inferior vena cava. Now the external iliac artery is going to go into the leg and become the femoral artery. In the leg, it's going to supply blood to the muscle tissue and other tissue cells, drop off its oxygen, and return as the great saphenous vein. So this vein is going to go up and drain into the femoral vein. The femoral vein is going to drain into the external iliac vein. External iliac vein is going to join with the internal iliac vein to form the common iliac vein. And then that's going to drain into the right or left brachiocephalic vein, which drains into the superior vena cava, or directly into the inferior vena cava. Let's go back to the heart and take a look at the left side. We have the aortic arch, and then we have the descending aorta. Then we have the left renal artery going to the left kidney. Left kidney is going to drop its oxygen into the kidney tissue cells, become the left renal vein, and empty into the left brachiocephalic vein, which is going to drain into the left atrium. Then we have the celiac trunk, which is going to give rise to the splenic artery and the hepatic artery. So the hepatic artery is going to go up into the liver, and the splenic artery is going to go into the spleen. Both of these are going to drop off their oxygen to those organs, return as the hepatic portal vein and the splenic vein, drain into the portal vein, which is going to take it to the liver, filter it through the liver. And then the clean blood is going to return to the heart through the hepatic vein into the inferior vena cava, which is going to go into the right atrium. Okay, so that was a quick review. You can see the blood leaving the left ventricle traveling through the aorta to the rest of the body, dropping off its oxygen, returning back to the heart, either in the head and neck region through the superior vena cava, or through the abdomen through the inferior vena cava into the right atrium. And from there, it's going to pass through the tricuspid valve into the right ventricle, which is going to pump it into the lungs to get oxygenated. The oxygenated blood is going to return to the heart through the pulmonary veins and enter into the left atrium. It's going to go through the mitral valve into the left ventricle. And then the left ventricle is going to pump it out again. I hope this video was helpful. If you need additional help with this topic, check out the links in the description. All right, thanks so much, and have a great day.